Welcome to DM. DM is a unique, simple, and efficient way to monitor your dental treatment. Let's take a tour of what you'll need to get started. This box contains your scan box, the ideal tool to get picture-perfect scans of your mouth and teeth. The instructions for use. They're full of precious information. Make sure to read them carefully. You'll also need these special cheek retractors. The last thing you'll need is your smartphone with the DM app installed on it.
After the app is installed, log in with the password that's been emailed to you. Once in the app, tap the icon on the top left of the screen to pull up your preferences. Select Scan Mode and choose Scan Box. This will show you the following tutorial on how to set up your scan box.
Let's see how to pair up your phone with your scan box. Hold the box with the scan box logo facing you. Open the lid and place your phone on the bottom left corner. Over the blue arrow, latch your phone in. You might have to take off your phone case for this. Make sure to note the position of the tuning button. Then turn the box around. Push and hold the tuning button, and slide the phone case until the camera lens lines up with the pointer on the right. Then release the tuning button. Your phone is now in place.
Clicking First Setup of your scan box will show you the basics of scanning, and then after that I'll show you a real scan.
Ready to start scanning? Let's go! Standing in front of a mirror, start by inserting your retractor, one side first, then the other, with the arch down under your chin. Bring the scan box up to the retractor. You'll hear a click as the scan box snaps into position. During the scan, audio and visual instructions will tell you what to do with your teeth. Bite down on your back teeth. When you hear this, bite down and keep your teeth together. It may help to swallow as you bite down. Open your mouth slightly and keep your teeth apart. When you hear this, open up and keep your teeth about a finger's width apart. Open as wide as you can. When you hear this, open wide and keep your teeth wide apart. In addition to instructions on tooth position, you will also be asked to move the scan box. Side-to-side scan. You will be asked to scan from side to side. To make sure to get a good view of all your teeth, scan all the way to each side. It may help to move your head slightly in the opposite direction. Up and down scan. You may be asked to scan up and down. Tilt the scan box all the way up, then all the way down. Once you're done with your scan, separate the box from the retractor. Use your thumbs to keep the retractor in place, then pull on the box. Now you're all set.
Now it's time for you to do a practice scan. First, some basics. To start off with, make sure that your phone's ringer is on and the volume is fully turned up, else you won't hear the scanning instructions. The instructions that you hear in the next video will actually play for you in live time, explaining all of the steps you need to take every single time that you take a scan. Once you've done this, click Test Scan. If you do not have aligners yet, that's okay. This is just for practice, so do it without. In this video, the words and actions are all mirrored, but since you'll be looking in a mirror, it will look normal to you when you actually try it.
Let's start. Place your phone into the scan box and latch it in. Insert the cheek retractor and snap the scan box into place. Double tap on the screen to start the scan. Insert your aligners. Double tap to continue. For this next step, you'll have to keep your teeth slightly apart and scan side to side. Double tap to continue. Open your mouth slightly and keep your teeth apart. Shift the scan box to one side. Now, shift the scan box to the other side. Back to the center. We're done.
Your real scan has more parts to it, but for now, this is good practice. If you struggled with the scan, take some more practice ones. Once you have started treatment and have your aligners, it's time to take your first real scan. To do this, go back to the main menu. You can rewatch the tutorials if needed, but underneath that is a button to take your first scan. If you're ready, click that button and we're off to the races. With real aligners, one more important thing is to bite down firmly on chewies or munchies for a few minutes before scanning with the aligners in, so that they fit all the way. After you've taken your scan, I'll take a look and see how the teeth are moving. I'll also look to see how the bite comes together and how the trays are fitting on the teeth. As you move through treatment, I will be able to compare the position of the teeth and make sure they are moving into the proper spots. My goal is to make this happen as quickly and efficiently as possible. When a tooth is not fitting in the tray very well, it means that it's going to stop moving. If I see this, instead of changing you to your next tray, I will send a message telling you to keep the same trays in for a little longer and then do the scan again in a few days. The message will look similar to this. After the next scan, if the trays are fitting better, I will let you know that it's time to change to your next trays. On my system, the red squares indicate when trays are not fitting well enough to move ahead. Notice the red squares at the beginning? The patient wasn't wearing the trays enough, and so the teeth weren't moving. Because he couldn't move ahead, he wore the first tray for 7 days, then an additional 3 days, and then 3 more days. So it took him 13 days for the trays to fit well enough for me to give him the go-ahead and change to the next ones. On his next tray, it took 7 days and then an additional 3 days before he could change. After this, he realized that the more he wore his trays, the sooner he would get to change. By tray 8, since he was wearing them so well, we had actually sped him up so that he was changing every 5 days instead of every 7 days. If you have any concerns, or if any of this is confusing, don't worry. Just send us a message through Dental Monitoring and we will be there every step of the way to help out. Let's get started.